I'll talk about first that crisis where we are, where we were, and where I hope that we'll be headed. I'll also talk to you a little bit about some architectural tools, some solutions to this gap of inclusion of autistic needs within the built environment space. And I'll illustrate that with a few examples in healthcare and education and at the urban scale, just so we can understand what it means in real space. And then finally, I'd like to share with you what I think is probably the most important message I want to bring to you today, which is the importance of bringing the autistic voice to the center of this process and ensuring that it informs how we engage, how we research, and how we move forward, and how we celebrate and elevate the autistic voice in the design process. So to begin with, I'll start with this notion of human-centered design. So many of you that have been engaged in built environment discussions recently will be familiar with this term that has become very popular about thinking of the architectural environment through the perspective of the user first and the human first. The critique I have of this process is that in large part and in the majority of times, that human at the center is not an autistic human. That human at the center is not a blind human or a deaf human, may not be assigned a gender other than a male-centered gender. So when we say human-centered design, I think we really need to challenge that dialogue and ask, who do you mean when you say human-centered design? Who is that prototype in your mind that informs the design decisions that then revolve out of it? And this is not a new critique of the built environment, and it's not a new critique of how we design. It began in the modern school of architecture with the visions of Le Corbusier and the modular, and this attempt, however well-intentioned, to standardize how we think about design. The issue with that model is that, again, that standard modular person at the center of our design standards evolution was a male, able-bodied, hearing, seeing, moving, white individual, neurotypical individual. And so many perspectives that I believe we have a responsibility to engage with were excluded entirely and remain in large part excluded entirely from that process. And to add on to the complexity of the crisis that we're in, that neurotypical white, able-bodied, seeing, hearing individual reduces a person to one identity. And a lot of times when we design and when we teach young architects to design, we reduce users to a single identity. When society tells us that actually our world, everyone within it is always more than one thing. And I love this graphic by the wonderful artist Mona Chalabi, who illustrates this notion through the population of New York City. If we were to reduce the population of New York City to 100 people, 68 would be people of color, 37 would be immigrants, 19 would live in poverty, 11 would have a disability, and 14 would be over the age of 65 and be categorized as seniors. And when you add all those numbers up, they don't add up to 100, which means that many of these individuals actually intersect between these identities. Neurodiversity isn't even one of these categories that this interrogation engages with. But what this tells us is that not only are these identities excluded from that neurotypical model or that normative model, but also the dynamic that every person is more than just their neurodiversity or their autism or their gender or their race, that people are actually more complex in their identities and therefore in their needs. That also is not being interrogated appropriately in our built environment world. And again, this is not new conversation. Our model of how we've been thinking about disability over the past century has really thankfully evolved, although I think there is more work to be done. We have moved away from the more medicalized model that saw neurodiversity as a pathology and any engagement with it as a cure or as treatment. And that was positioned individuals with autism and neurodiverse individuals in a position of sympathy. So there was this power hierarchy between those that knew and those that did not, or the haves and the have-not. So we've moved from that medical model more to the functional model, which moved in post-World War II in mid last century, and it was about people's abilities that were limited, that needed to be rehabilitated, but it still also assumed a certain normal function that we were trying to bring people into. More recently, in the 1960s, with different social justice movements, emerged the social model, and that's where things like the Americans with Disability Acts and different movements across Europe began to look at society as the root of the issue, in that society was not equipped and prepared and designed to accommodate the needs of people with differences. And today we are moving more towards a cultural model where I see autism as just a different way, but an equally valid way of how we perceive the world. And in the past few years, I've pushed that model a little bit further to this notion, Damon Milton's notion of double empathy, where we need to look at the interaction between individuals and see autism as actually a root of expertise. And the best way I can illustrate this is a phone call that one of the parents that I work with received from her son's school, saying that she needed to come in to meet with the teachers because her son wasn't playing with his friends and wasn't playing correctly with his friends and was causing problems, and there was a lot of tension in the classroom. Her autistic son was not getting along with his classmates because he wasn't playing with them the way he should be playing with them. And when she came in, she asked the teachers, well, are they trying to play with him the way he wants to play? Why is it his responsibility and his burden to change the way he plays or to change the way he learns? And I think that's a good example of the double empathy problem, that we need to disabuse ourselves of this normative stances of there's a way to design, there's a way to be in space, and stretch that. And that's where the word spectrum comes in. We need to really stretch how we're thinking about all of this. And in 2014, over a decade of research, we were looking to formalize how we can spatialize all of these ideas into concrete guidelines of how we think about the built environment. And we developed at that time what we call the Aspects Design Index, which is 7 principles related to built environment and space, through which they are a framework through which we need to think about space in a way to include the needs of the neurodiverse in this different autistic perspective. And Aspects has now been used in many different places around the world. This is actually an older map that needs to be updated, but we're happy to see that it's translated to many different contexts culturally. It has partnered with multiple agencies around the world, and we have had the privilege and opportunity to be able to apply it to many different building types with different partners in different contexts and really test it out and review it. And it's a continuous process of development. So just to explain the 7 principles of Aspects and illustrate them to you, the first principle is the principle of acoustics. And soundscapes and sound perhaps is as diverse the spectrum of autism is. And I'm very mindful of the fact that everyone and every autistic individual is different, is unique, has their own identity, personality, parameters, but acoustics seems to be, through our research, the one element that has a very high impact on the autistic perspective. So we have tested out different approaches to soundproofing, sound mitigating, to create these different soundscapes, and I'll show you some examples of that in a moment. The next concept is this notion of spatial sequencing, and spatial sequencing asks us to build on the autistic affinity to routine and the autistic need for predictability in space, and design in accordance to it as opposed to trying to change it. So rather than saying the autistic individual's connection to their routine is a problem that they need to break, we actually reinforce that as an asset and a strength. And that if we build on that need for predictability, it allows the individuals to move through space with less anxiety and less stress, because there is that expectation is and anticipation is more managed. So spatially, what that means is that we organize spaces in a sequence that is parallel to the process in which they will be engaged in, or the time frame in which they will be engaged in. So for example, if it's a workplace environment, you arrive, you go to your desk, you put away your things, you take a cup of coffee, you go to a meeting, you then go to lunch, and so on and so forth. So you have a timeline of your day. Whenever we can, we organize the spaces of our building to reflect that schedule. And there are many examples in hospitals, when you check in and are admitted, when you have your patient intake, when you see your first screening before you go to your procedure. Each of those moments needs to be organized in a sequence that reflects the way you will be experiencing them to reduce this anxiety. The third principle is a very important principle, and possibly the most agile and easy to implement, which is the notion of escape. And I've evolved it to what I call an escape-scape, which is an entire landscape of escape spaces that can be distributed throughout our spaces to allow autistic individuals, and really any individual, when there is this sensory overload, to remove themselves from space to somewhere that is quieter, somewhere that is softer, somewhere that may be embedded in nature, somewhere that they can be alone or in a smaller group, where that sensory environment can be more managed. And I'll show some examples in a moment. Compartmentalization, and it can be applied to multiple scales. So we see here a small interior scale of a classroom, all the way up to the streetscape scale of an urban environment. But the idea of compartmentalization is to limit the amount of sensory information that an individual has to deal with to only that which is necessary to the task at hand. And it's interesting, Isabella's presentation just now was talking about scale and the hypothesis of how we perceive virtual space related to scale. And I thought that was very interesting, and it tracks against this notion of compartmentalization. Transition is a tool that helps reinforce the previous tools. So what transition calls for is for us to create and allow for spaces for individuals to move when we can't sequence experiences in a way that is more seamless, as spatial sequencing asks us to do, because that is not always possible. What transition will allow us to do is to create that moment for sensory regulation. So for example, the images at the bottom are on a university campus. When students arrive from a very busy city in transportation network, from the bus or the train, and arrive onto campus, before they are expected to leave that high stimulation sensory environment and go learn and focus or take an exam or attend an interview or give a presentation, which is a very high focus activity, transition spaces allows them that moment to recalibrate that sensory overload. So they're better prepared and they are more set up to be successful in that next activity. And really that's something that I think everyone can benefit from. And there's a lot of emerging anecdotal evidence that we're receiving that a lot of these tools actually work for everyone. Sensory zoning is interesting because as designers, we are trained to think about function and utility and to organize our buildings in accordance to that notion of function and utility. So offices next to offices, classrooms next to classrooms, bathrooms, kitchens next to bathrooms and kitchens. But we don't look at the sensory qualities, both the active and the passive sensory qualities of each of those spaces. So what sensory zoning asks us to do is to think about utility, but also within that utility grouping to think about the sensory environment. So if I have, for example, a group of classrooms, some of them may be music rooms or theaters or active spaces, and some of them may be more quiet, focused spaces, and to organize those separately and not to mix them, and then to create transition in between. So again, we're moving from low stimulation to high stimulation spaces, or high stimulation to low stimulation spaces in a more seamless way with transition in between. And finally, of course, safety, and there are multiple examples of how we can embed safety into our built environments, and I'll show you a few of them as well later on. And as part of our commitment to ensure that we are always evolving and growing and responding and listening to the autistic community, last year we developed the Autism-Friendly University Design Guide with some partners in Ireland, Dublin City University, and As I Am, which is the National Autistic Society of Ireland. And part of that process was a revisiting of the original 7 principles of aspects to expand them to include other notions that were beginning to emerge in our research to become 15 criteria. So the 8 new principles are color. We did some investigation and surveys as to color palettes that were useful, lighting and some requirements, and what we heard from the community about what they would like to see in the lighting systems and the lighting principles. Materials and their impact on the tactile environment and on the acoustical environment, and also furniture and the role furniture can play in creating compartmentalized spaces, in creating escape space. So a lot of the principles of aspects 2.0 are actually tools to reinforce the original 7 principles. The 5th new principle is the notion of wayfinding, and I'll talk to you a little bit through a clear example of how wayfinding and navigation can be designed from the autistic perspective. A lot of it is about order, a lot of it is about clarity, about setting the rules of how to engage and move through space. And interestingly, during COVID, a lot of the autistic community that I worked with through COVID mentioned and had observations that the one-way pathways that we were putting into our public spaces, so people entering the space would stay to the right and people leaving the space would go to the left, and there were arrows on the ground to help guide space to avoid face-to-face crowding to prevent COVID. But the autistic users, some of the students that I was working with at the time at Dublin City University, actually appreciated that because it gave them a little bit more control and predictability to their experience in spaces that otherwise had been very busy and overwhelming for them. The last 3 principles relate to technology and smart systems, something that I call sensory economics, and more dynamic elements like programming and operation. I won't get into them now, but I'm happy to talk about them in the questions. But I'll only say that it was so interesting to hear Isabella speak, because we have been scoping out the use of virtual environments and augmented reality to support transitioning and predictability, and to test spaces for clients in a way that is inexpensive in a virtual digital world, to test the impact that it would have on autistic users for various perspectives. The healthcare environment, for example, is very interested in that. So I was very happy to hear about that. And when all of these 15 principles come together, we believe we can create very beautiful, sensory mitigated, accessible, available spaces, not only for the neurodiverse autistic perspective that was the center of what produced these spaces, but for everyone. So very quickly, I'll go through a few examples of how this is applied to design in certain projects, but also how it applies to built environment research and some tools that we have developed over the years. So I was involved in designing the University of Nebraska's Medical Center's Monroe Meyer Institute with Altus Studios in the United States. It is a full-service hospital treatment center focused primarily on neurodiverse, developmentally challenged, and autistic users. And as a hospital environment, it was interesting because embedded within it was also early intervention autism center, almost separate from the hospital prior, but embedded within it. And I was brought on primarily first to help the design of that section, which is the yellow section in the middle diagram that we see here. But very quickly in conversations with the client and with the architectural partners that I was working with, I managed to push my agenda of autism-specific design out into many of the spaces that weren't originally anticipated or perceived to be autistic, serving the autistic population primarily. And the reason I did that is my belief that everyone can benefit from the kind of strategies that we call for when we design from the autistic perspective, but also the assumption that only the students in the Autism Early Learning Center are autistic and that they don't have any autistic staff members or they don't have any autistic graduate students who are coming to study at the school. They don't have any autistic family members who are coming with other patients to seek help for other reasons. So one of the things that we did is that we embedded within the hospital environment various escape spaces. We worked on the wayfinding and navigation networks to couple that with the escape spaces throughout the hospital environment that would allow all individuals to be able to tuck into spaces. We also worked on wayfinding and navigation. Another healthcare environment that I was engaged in a few years ago with Abe Rogers' design around the Wolfson Economics Prize for planning and designing the hospital of the future. This was, again, primarily inspired by the COVID crisis, but Abe and the team that he convened that I was very privileged to be part of thought about how we can rethink the hospital environment for everyone, not just from the perspective of COVID. And some of the principles that I was able to bring to the table related to the process through which that we can engage in spaces and how we can embed escapescapes, transition spaces, and spatial sequencing throughout the hospital. And one of the reasons this was so important to me is that there are very shocking statistics around the lack of access for autistic individuals to primary health care unrelated to their autism. And these statistics show that there are higher mortality rates and higher complication rates for medical problems that have nothing to do with their autism. And the research that's emerging in response to this problem that people have identified is that the built environment plays a role in part of that. It's not the only thing and it's not the most important thing, but the built environment of how we design our hospitals is creating a barrier to autistic individuals getting the primary health care that they need. And as a result, they are not as healthy and not living as long as the general population, which is a big problem. Other projects that we've applied aspects to, this project is what I call a triple vulnerability community. This was a residential school for autistic refugee Palestinian orphans in Ramallah. So these were children who were abandoned by their refugee families because they were autistic and were orphaned in this community and taken in by families in this community who then were able to fundraise and contact me to come in and support them in designing this center. At a larger scale, we have applied aspects to through the urban scale. This is the Sharjah City for Humanitarian Services, which provides incredibly helpful services to the Emirati population in Sharjah. And in my work with Dar al-Amran, Rasam Badran, and other colleagues there, we were able to look at different landscapes, we were able to integrate sensory gardens, and we were able to think of wayfinding and navigation in a way that not only supported autistic users, but their families as well. And we were also able to push the agenda of autism friendliness and neurodiversity principle design out into the community. So there were businesses and hotels and museums and residences in the rest of this complex that part of their what our proposal was that part of their requirement would also be to be autism friendly. Aspects has also informed a lot of research that we've been engaged in over the past few years. As part of the autism friendly design initiative that we did in 2020, 2021, we developed what we call the autism friendly design audit, which is a checklist. It's publicly available, it's published online, and anyone can access it. It's a tool that you can use to score existing facilities to measure their autism friendliness. And it works across the aspects index. It has many more principles than what are on the screen, but it is a way for us to assess existing built environments, but it's also a way for us to plan new built environments in a way that will ensure, hopefully, their autism friendliness. We've also in our research been looking at how the aspects tools, where we stand as aspects and aspects 2.0 against other current autism research, but also other building principles like the well building standard that looks at healthy living and healthy buildings and how they can play a role in the success and productivity of individuals, although not focused on autism and neurodiversity at all. But there are principles within the well building standards that look at acoustics, that look at lighting, that look at thermal comfort, that we found tracked, interestingly, between aspects and aspects 2.0, which is more evidence of the fact that designing from this autistic perspective is actually beneficial for everyone and can result in buildings that are more comfortable. These well-building standards are the comfort criteria for everyone, and there is evidence to support that. We've also been looking at how aspects intersect not only with the well-building standard, which is for neurotypical populations, but also for other sensory challenges like deafness. So this is some a mapping of some work that I'm working on currently with Hansel Baumann, who is the author of Deaf Space and who is one of the partners that I'm working with currently here in New York, and looking at how the principles of aspects and aspects 2.0 track against the principles of Deaf Space and where there are actually win-wins to be had. Other research we have done is using these aspects tools to measure and assess the performance of current and existing buildings. This is the Western Autistic School by Paul Heed Architects. They designed actually 2 schools in Australia, and they were part of a 5-school assessment that we did based on the aspects framework. This is a school by Simon Humphreys, the Dubai Center of Autism, which was recently opened, and Simon and I have been in communication. I hope to be able to visit it maybe again and see post-occupancy if some of the original observations we had have actually panned out. And through a series of surveys and professional assessments and audits of spaces, we were able to identify that there is a strong alignment there's a strong correlation between user scoring of the autism effectiveness of space and the aspect scoring of the autism effectiveness of space, which gave us a little bit of indication that the aspects tools can actually be predictive of autism performance. We've also used the aspects index to go in and do retrofits on schools. This was from the ELS Center for Autism, and I'm working in partnership with them currently to publish the results of this research. But we went into the school, did a post-occupancy of the existing facility, introduced some design retrofits, and then went back a year later to see the impact of those design retrofits. We did classroom reorganization and compartmentalization. We introduced what we call the purple pods, which are quiet, acoustically managed transition spaces and escape pods throughout the school, along the wayfinding circulation, but also outside of the classrooms. And these have been so successful that although they were originally designed as transition spaces as children come in from the playground or their art classes or their music sessions before they go into the classroom where they're going to focus, they are invited to use the purple pod for a moment to do that sensory calibration if they would like. And it has been so successful that students are asking for it as a form of reward for the positive reinforcement for tasks in the classroom. They have also been seen to use it to socialize and to have conversations, which is something that they hadn't initiated independently themselves in the past. So there's a lot of positive feedback that we're getting on that use. I'll revisit just very briefly the idea of this intersectional thinking, that a lot of times there may be a critique that I hear from clients and I hear from the general population that this is a very specialized field, that this is really only relevant when we're designing a building that is intended to be occupied by autistic users, like an autism school or an autism center, or a residence that has autistic family members. But actually, as I showed earlier, there's a lot of intersection between aspects and other ways of thinking about space. But also, when we embed aspects principles across other populations, we can create very effective intersectional spaces. So this is work from Mixed Design, the design think tank and design consultancy firm that I am a partner in here in New York. And this is a project that we are still currently working on. This is the entry sequence to a residential college in an Ivy League university here in the United States. And it looks at a philosophy that we have developed at Mix that we're calling multisensory wayfinding. It's about thinking about the navigation of spaces like university college through the senses, very much like we do for aspects. And here, what is interesting is that the tactics that we utilized and recommended for the autistic population were actually found to be useful, for example, for the deaf community. So to the left, I think, of your screen, you will see what we call the calm zone, which is actually an escape space that bulges out of the main pathway. And it is very much like the escapescapes that I showed you earlier at the Nebraska hospital, but it also is a space where deaf users can step out from the stream of circulation and able to have a conversation without the visual background disturbance and being able to face one another so they could speak to each other. And that is something that also autistic users would retreat to. The cubes in the center, the cones in the center of the space also create these little quiet islands of acoustical control that were put in place for the autistic users, but can benefit anyone that wants to step out of the noisiness of an entry lobby and have some quiet. That could be an elderly person who's overwhelmed from the sensory environment. That could be a migraine sufferer that needs a little bit of quiet and needs to step out of the space without retreating entirely to a new space. So by looking at the very simple architectural element of the corridor, we were able to really tease out how different users can use the same space, how tactics developed for one user group, like aspects or deaf space, actually are useful for other user groups, but also to identify where there are conflicts. So for example, deaf space principles calls for a lot of transparency and visual access, and that can be something that is overwhelming and gives visual cues that can be overstimulating for autistic users. So how do we then mitigate that conflict? And we're also collaborating at Mix with architects like Chris Downey, who brings the blind perspective to our work. And finally, I'm going to leave you with where I am at right now in my work and the problems that we're hoping to tackle in the next phase of our work through, again, the autistic perspective. And this is what I call the sensory as commodity. We currently, and I'm here in New York, and New York is a perfect example of this phenomena, as many of our cities are. We are currently in a sensory crisis where our built environments, particularly our urban public spaces, have been entirely colonized by sensory commodification. Every surface is up for sale for advertising, for streaming, for motion, for visual stimulation, with no regard to the sensory disability that can create to users who may not be comfortable processing that much information at once. And I'm sure that this is not a surprising observation in this room of people who are experts in this field and understand the autistic perspective so well. But the image of Tokyo, the other image is actually an image created by my friend and collaborator, Stuart Nielsen, that we hosted at my show in the Venice Architectural Biennale in 2021. And it's an image of a single space over time, overlaid on top of one another at University College Cork, in a space that was supposed to be for autism support services, but because of the way it's situated and its transparencies and the traffic that goes in and out of it throughout the day, it is a very sensory overwhelming space. And I think it's one of the things that designers are completely ignorant to. We allow sights, sounds, images, movements, textures to come into our spaces for either economic or aesthetic reasons without considering the effect that they can have on individuals on the spectrum who may, as a result, not be comfortable in these spaces or may even not be able to access these spaces because of that. And I think that's something that we need to change, and we need to confront in a process that I'm calling a sensory decolonization of our spaces. And the solution to that, I really think, is the need for the autistic voice. I've been developing strategies and tactics. These are images from workshops I've conducted with autistic communities, both in person and virtually. And we learned a lot of lessons from this process, that a lot of the tools that we as investigators and researchers use and have used, and I myself have used without consideration of their accessibility to the autistic community, need to be reinterrogated. So when we run a focus group, when we conduct an interview, when we send out a survey, we are assuming a certain level of communication. We are assuming a certain perceptual model. We are assuming a certain social communication ability that is normative and that may not be available to an autistic individual. And we have a responsibility as a research scholarship community to rethink our tools and to think about tools that can perhaps be visual rather than verbal, that can be more organized and ordered rather than overstimulating, that can be one-on-one and personal rather than dependent on a broad social environment, that can be predictable and planned and scheduled, and that most importantly, position the autistic user as the expert. And for too many years and decades, autism has been a subject of study, which was important, and I'm not diminishing that importance. And I myself studied autism as a subject and autistic individuals as a subject, but they are individuals. They have agency, they have a voice, they have an opinion, and they have expertise. They have been engaging in their built environments for their entire lifetime, and they have developed many times brilliant coping skills to manage these environments that we have created for them with no consideration of their needs. So that expertise is an incredibly valuable resource that has been entirely ignored. And I think the work that I would like and have been engaging with recently and will plan to continue to engage in is this movement of the autistic as expert and really harnessing the power of autism-centered design. And I'll show you some very quick examples. These are images that were recreated for me by the brilliant photographer Magda. I call this series Too Much Information. And it is a recreation of images that were shared with me almost 20 years ago from a mother whose son was struggling in his school. Her autistic son was struggling in his school to find activities and subjects and material that he could excel at. And like many of you know, that was a challenge to find that strength-based fit and to find something that worked with his skills and his brilliance. So someone suggested a photography class. He went to the class. The teacher assigned 5 or 6 things that they were supposed to go out with their cameras and photograph. They were supposed to photograph a puppy, a tree, a house, a boy, and come back to class. And the teacher called the mother in and said, "I'm sorry, the class isn't working for your son." He completely misunderstood the exercise and came back with photographs that didn't have a tree, didn't have a puppy, didn't have a house, didn't have a cloud, didn't have a boy in their frame. So he misunderstood the assignment. And when the mother asked to see the photographs, she quickly realized that what the son was taking pictures of was the shadows and the reflections and the silhouettes of those objects as opposed to the objects themselves. And this gave them an insight into this coping mechanism that this little boy had created to navigate the visually overstimulating world that he was in. So the teachers that were, and if all of you remember 20 years ago, forcing eye contact was a big movement in autism, and teachers were forcing him to make eye contact, and his lack of eye contact was a problem, and to them was an indication of his lack of focus. But when they realized what he was doing, He wanted to follow the teacher and he wanted to follow her instruction, but he just couldn't handle all the visual information and the eye contact that was required of him to look her straight in the eye while she was instructing him. And what he did was he followed her shadow instead. So he could see where she was pointing, he could hear what she was saying, he could integrate her movements with just the silhouette of her shadow on the ground or on the wall that gave him just enough information that he needed in order to learn from her. And that was a coping mechanism and a spatial visual tactic that he had developed himself. And to me, it's such a beautiful example of autistic expertise that had we listened to that photography teacher that said he failed the assignment, we would have never discovered this coping mechanism and this brilliance of expertise that he had that he could bring to us. And that has since come into our work in minimizing visual detail, in being cognizant of the reflection and the shadows of objects that may be indicators of how people navigate and engage through space. Another example of this autistic expertise came from Dublin City University when I was doing one-on-one sensory audits of the space with one of the autistic female students there that was studying at the time. And she shared with me, this is a layout, a map of the campus. The central section where the numbers 7, 8, and 4 are is the central plaza of the campus and is the easiest way for people to navigate through campus. But in that central plaza would be food trucks, music, celebrations, sports events, announcements. It was a very crowds. It was a very noisy, overstimulating space. So what this young woman did is that she found a series of pathways between and around the backs of the buildings and created a loop of alternative pathways to get to her classes and get to where she needed to go that avoided completely the central plaza. So it wasn't a formal pathway. It wasn't completely connected. It wasn't all paved, but she was using it as, again, a brilliant coping mechanism to avoid that sensory stimulation in the center of the plaza. And we have since formalized that. We call it the Milena pathway. We named it after her. It is a sensory alternative pathway that weaves around and between the smaller, quieter spaces in between the buildings of campus that can allow you to navigate anywhere on campus without having to pass through the sensory overstimulating plaza. It gives choice, it gives agency to anyone to use space and navigate through space as safely and as efficiently as they are capable and comfortable doing. Also, along that pathway, we've married it with the notion of escape space. So there are the escapescape is organized throughout that pathway with benches and natural environments. And just a few weeks ago, I received from Stuart, who is now working at DCU, some images of his visit. So as part of the research that he and I are working on, he has gone back to Dublin City University and investigated using this brilliant, beautiful visual manipulation technology and research method that he has developed through photography again. And this is a series of images from the Milena pathway when it was in bloom, with the vegetation that has put in place. And the overlay shows the softness of the space, shows the quietness of the space, and shows a space that was developed from the autistic perspective that is being viewed by the autistic perspective of Stuart Nielsen. And finally, I'll just leave you with this final video by Stuart that I think is really just so beautiful, because it is an overlay of video that he took while he was in lockdown in his home in Ireland. And through it, he realized the pathways of the birds flying through his city were actually mapping and tracing the abandoned streetscape of the city. And only an autistic mind would have developed these visual tools to look at space through the lens of the camera that is more comfortable to perceive space, but also only the brilliance of an autistic mind would have uncovered this pattern of the birds flying over the city in a way that mirrors the fabric of that city. And finally, I'll just leave you with, as we open the floor for questions, some of the resources that I shared with you today, the Autism Friendly Guide, the Venice Biennale work, and some other articles and material that some of you may be interested in. Thank you very much, and I'm happy to take questions.